Hey Ford, do you really need statins to reverse plaque?
No. In fact, you know, it's an interesting point. When I first did a couple of videos on reversing plaque, and that's not necessarily a practical goal anyway. It's kind of rare for people to actually reverse plaque by the standard ways of measuring it. You can reduce your risk. That's a very, very attainable goal. That's a very practical goal. So the first thing to think of is, do you really want to focus on reversing plaque, or do you just want to reverse your risk, which everybody can do? I would choose the latter. The second part of that question, though, has to do with statins. Do you have to do that? Again, there was the head of cardiology at Harvard made a comment about plaque reversal a few years ago. There was some debate on it online, and people were saying it's impossible, it never happens. And he was saying that's not true. We've seen plaque reversal before. And he named two places where you tend to see it. One is addition of statins to somebody that's never had a statin before. And that was me, by the way. The other time that you tend to see it is when somebody has lost significant weight, like 30 pounds or more. In both of those conditions, what you're seeing is decreased inflammation. So that's the final thing that I wanted to mention. What is plaque reversal? Is it pulling that LDL out of the plaque, or is it something else? And I would say it's really something else. What's going on is typical soft plaque or mixed plaque. Soft plaque has inflammation in it. It's got inflammatory cells that are attacking that plaque. It's got what we call cytokines, things that are pulling more inflammatory cells in there. And it's got more liquid. If you get that inflammation out of the plaque, you're decreasing the liquid and sometimes can even measure the decrease in the plaque as you stabilize it. That's what you really want to accomplish. The way measurement is these days, you're not likely to actually see that decrease. But when you do see it, it's most likely decreased inflammation.